Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geeky. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community.
Hi, I'm Danica Koopmans, one of your hosts of the Docs of Vernon interview series, and today I have the privilege of interviewing Dr. Nicholas Half. He is an MD, FRC, SC, OBS Gynae, who is also just a true generalist of the profession. That is his passion, his love, and he enjoys teaching. And pelvic floor conditions are one of his specialties. He also does colposcopies, not to be confused with colonoscopies.
No.
So thank you very much for being here and taking the time to chat with us.
Nice intro, thank you.
You're welcome. So my question just to start us off is, can you describe to me what a day in your life would look like?
Getting up same time mostly every day. Try to get up around 6 in the morning, depending on if you try to get some exercise before you go to work. But some days you have to be working by 7, some days you don't have to be working until 9. But it's a mixed bag. The week is, 5-day work week, but it's different between clinics, operating, call, colposcopies. Yeah. So, but usually, I'd say my workday finishes between 5 and 6:30. Then you're doing paperwork and either be dealing with the kids stuff and then doing it late at night or doing it on the weekends. But
So I gotta ask, was it hard not to medicalize your wife's pregnancies with your children?
No. Very easy.
Or did you go right into like dad mode?
Oh, dad mode, husband mode. Yeah, no, there was no. In fact, people ask me, would you even want to deliver your own kids? But the whole no, there's nothing.
What is your area of passion when it comes to teaching, or I just really wish people knew this?
It's patient interactions and counseling. So I think nothing can be understated. I mean, no doctor is going to know everything and be the best at something, but I think how you portray, people want to be heard. So you spend time with them, hear them, and then educate them, right? And then where the cards fall on what they want to do, it's up to them. And so we get taught in the mantra now of patient-centered care. Right? Mm-hmm. So our job is to inform, but it truly is a magical encounter if you can incorporate that. So my job is really to show them that this is an effective way and a gratifying way of practicing medicine. Mm-hmm.
Yeah, absolutely. It does sound, I love that you used the word holistic. I don't know that I would have thought of that specifically, but in a lot of ways, if you are dealing with cancers and then young moms, new moms, and, these situations that can be truly terrifying and amazing all at once, I don't think there is another way to deal with it but holistically, right? That's beautiful.
Well, there's two ways you can interpret that. One is the relationships you can build with the patient over time. So, right from a baby to death, right? So it's kind of like I remember having a brief moment in time where thinking maybe I'd do family medicine in a rural community because they can have their jack of all trades and they can do a lot of stuff. But this kind of fed that for me in the sense that I can see people multiple times throughout their life, right?
Yes.
And then two, the other holistic thing is there's so many conditions in women's health where I'm just one piece of the treatment options. And so seeing what other people want to do on their own with their own research or naturopaths or, other nurses. There's so many facets I just love being part of that too. Yeah.
Is there any situation that you would say, as a general rule of thumb, that's unsafe? That is not what we want to see happening, that we can prevent? Well, that's a big question.
It is, that's right. There's stuff you see in the office where you can talk about general health, and there's stuff you can see in the hospital, like on the labor floor, and there's stuff you can see and during surgery. So I think it kind of depends on what part. I think the classic situation is where maybe screening, we'll talk about cancer screening and the importance of it and when it can prevent. But it's obviously, a lot of the cancers, especially in a well-screened cancer, we can prevent a lot of these. And where we see cancers pop up is in the unscreened or underscreened population. So But is that something I say don't do, or no, you're bad for doing that? No, I mean, again, it's always going back to why don't you want to be screened, right? And if you don't do screening, this is the potential outcomes for that, and then people still have their own reasons. And you can go on the opposite side where someone actually has a cancer and say, this isn't it. I can cure this cancer with this treatment. And someone's heart is like, no, it's not what I want to do. I don't want to do traditional medicine. I want to go do this. And in your heart, you're like, but we have this opportunity to cure you.
Yes.
And in their heart, though, they're like, I don't like what you're offering. And in my heart, I need to go do this. I'll come back. Yes. So you don't make them feel guilty, right? And again, you let them do what they need to do, but you just have an open door.
Yeah. Yeah. So, the question was, if you had HPV positive, would you still get vaccinated?
So if you just had HPV, at least from a data perspective, I'm not sure if there's any data that would say, hey, if you get this vaccine, you can clear it this much faster, or you're much less likely to get this happening to you. But we do have data on if you have an HPV-related disease. So let's say you did get warts or cancer and got this vaccine subsequently after treatment, then yes, the chance of recurrences are much, much less. So we do promote and advise getting HPV vaccine if you had an HPV-associated condition. But just having HPV, not so much, but do I think everybody should get HPV vaccine? I think it's a really good idea. So from a biased, decision, if you can afford it, get the vaccine. And one is better than none.
Yeah. And also, like Dr. House speaking from the perspective of seeing people with cancer. And so if you can do anything to even remotely prevent that, why wouldn't you? Men and women.
Men and women. We're the carriers.
Yeah, the silent carrier.
And we, when they first came out with the vaccine program, it was just to females. And definitely the obstetric gynae was like, no, you got to include the boys.
Yeah.
You got to. You're going to, right? So and then eventually, it obviously came along. So, but I'm saying, for people who do come into colposcopy, of all the things I do in my clinic, it is the most stressful clinic, actually.
Yes.
Because when people get referred to me in my office, or I see them on call or in the OR, right, they're kind of expecting to see me. When they come into colposcopy, all they're thinking is, I think I've got cancer. And they don't know who they're seeing. And then they see some random gentleman like, hi, I'm Dr. Half, right? And already they're like, and they're not hearing much what you're saying or counseling. And then you're going straight to an exam. There's not much chit chat. So of all the things I do, it's stressful for patients, and it's, it'd be very, so what I'd like to say is that if you do have to go to colposcopy, right? I mean, hopefully there's information online, and there's always time for questions. We hope people have a good understanding. And we do appreciate the primary care providers, the nursing practitioners, family doctors, midwives, to really explain their PAP results to them and hopefully demystify some of that colposcopy stuff before they come in. Because you can tell. You can tell when someone comes in well counseled and aware of what's going on compared to people who have no idea. Yeah.
Absolutely. Please tell me how you came to be part of Dancing with the Stars.
100% my wife.
It's always the wife.
It's always the wife. She likes, she has special interest in palliative care, and especially in the past, but and she likes to do community-based stuff, and she's a dancer at heart. And so an opportunity came up and this is an annual event in Vernon and a lot of other communities. And so she planted the idea that she really wanted to do this. And I said, you're crazy. I like dancing, but I was like, if we're going to go up in front of hundreds of people and train, this is not something we're just winging on.
No, I'm not just showing up.
We're doing this daily.
We're getting a trainer?
So it was fine. I was like, but we can't do it daily. She's a physician as well. Our schedules are crazy. We got the kids. It's like, when are we going to, we'll be dancing at midnight. She goes, midnight it is. And that's actually what happened. We said yes. And you have a lot of time. And the hospice society that supports it or arranges it is so helpful. They give you an instructor. They show you how to fundraise. There's so much resources and time they spend on their own. And to this date, is probably the best experience I've had just with my wife and in Vernon. It was fun and amazing how you're dead tired at 11:30 at night, and it's like, okay, let's just dance for 5 minutes just to say we did it.
Yes.
And 45 minutes later, you're like, we're still dancing because you're just into
It's
it.
amazing.
So no, but thanks for taking the time as well, because I know this is a good cause, and
Yeah. No, thank you very much. And thank you guys for listening and watching. And make sure you stay tuned because there's so much more. If you're really interested in gynecology, obstetrics, both, all of it, everything, Vernon, you want to talk to Dr. Half some more, please don't hesitate. All the links are attached here, and you can just send us an email and we'll get you connected.
thank you.
Thank you. Bye for now.